Softly and tenderly, Jesus is calling, calling for you and for me.
I ask God each day, who can I help? And He shows me depressed people. Welcome everyone. You're watching Depression Hurts. I'm Dr. and Pastor Joe Allen of Panama City, Florida. In today's program, we're going to discuss part 2 of a recent topic called Depression and Addiction. I'd like you to get paper and pen handy now to jot down my 24-hour crisis phone line that you can call anytime for help, day or night. Friends, you may be in a situation today asking, how do I help a loved one or a close friend who's depressed from addiction? The first step is to realize that we all know that someone that is suffering from substance abuse addiction, they seem unconsolable and always sad, always sad. And that one time, the friend doesn't want to associate with you or interact with you anymore. It can feel like he or she is pushing you away. That's the illness talking. And trying to alienate them at all points. I'm here to tell you that it's not your fault. The important thing you can do for them is take them to a psychiatrist or public mental health clinic. An accurate diagnosis and treatment is certainly called for. It may mean also to monitor the regularity of taking their prescribed medications. That loved one or friend is secretly crying out for good listening from a good listener, with emotional support to give. Knowing that someone truly cares about them is a sparkling ray of hope that keeps the depressed person living another day. You should show them understanding, patience, affection, and compassion. Show them that God is the rock they can lean on. Before demonstrating these attributes, the depressed substance abuser was going through a tempestuous storm. Offer ideas that offer hope and help for an abundant life, free of illegal drug or alcohol abuse. You can be a true friend by taking walks with them, talking with them, taking them to the movies. If a patient turns down your offer, don't despair. Be gently insistent. Some favorite activities that once gave them pleasure, such as hobbies, sports, or church attendance, may get their mind off the depression they feel and suffer from. Be careful, because too much demanding can increase the feelings of failure on the part of the depressed person and you. The worst type of misguided treatments is to say, oh, cheer up, snap out of it. You must realize depression and addiction are illnesses just as real as diabetes or pneumonia. A sufferer can no more snap out of diabetes or pneumonia, so they can't snap out of depression in the same manner. In case comments warning their impending suicide come about, attempts being sounded, this is a red flag. You should be on the lookout in all cases. Share their intents with their therapist. Equally vital, I say, the patient cannot get better on his own without help. Only talk psychotherapy and appropriate prescribed medication can help a person in substance abuse depression. The compulsive urge of craving drugs or alcohol abusively will lurk around the corner of the patient's mind. It's kind of like a loaded gun at their head for a dose of substance abuse to pull the trigger. That's sad, isn't it? The most important thing they need is a good listener, like I said. A facial character on the part of the patient's influences the perception of honesty. Further, do not think a person is too young or too old to abuse substances and leading headlong into major depression. Actually, teenagers are some of the worst offenders. They're easily impressionable targets for this disease. You may be the suffering one who's fallen into relapse asking, what should I do? Here's a few ideas to consider in therapy. Cognitive behavioral therapy, CBC, is a form of counseling that identifies and changes negative thinking and behaviors contributing to your depression. By replacing bad, harmful patterns with healthy, realistic thoughts and actions, you can avoid the traps worsening depression. Second is interpersonal therapy, IPT, aiding by understanding personal actions, relationships, or interactions contributing to the disease. Ask your counselor or doctor before joining a support group. You may be too soon into your therapy to face a room full of other patients. It may be embarrassing for you. And it is effective in healing. Other therapies include maintenance treatment to head off future depressive episodes. This can last a year or even longer. It involves close, guilty, or sad feelings about the abuse. Finally, you may want to relapse when you try to stop using or having cravings, and they drive you back into larger destructive habits. What's the solution, you may ask? A program equipped to handle the dual diagnosis of addiction and depression is a sure way of getting guaranteed results. Getting you clean, such as in a rehabilitation facility or clinic. Meanwhile, don't go anywhere near drugs or alcohol unless it's your prescribed drugs and you're taking them as prescribed. Remove the tempting substance and you have a great chance of beating this illness. Now, I'd like to give you my 24-hour crisis line. Would you write it down? It's area code 540, calling number 305-1543. It's answered 24/7. That's time to end today's session. I'm Dr. Joe Allen, and as I always say, may the good Lord bless and keep you and give you peace.